Hello, my name is Madison Engel, and today I will be discussing Biomechanics Lab 2, a comparison of muscle activation during concentric, eccentric, and isometric wrist flexion and extension. The purpose of this study was to help us understand how to properly use Surface EMG to prepare us for clinical situations, and also to evaluate different muscle activity in concentric, eccentric, and isometric contraction types. We expect that there will be a larger EMG activity recorded for concentric contractions, and that the flexor and extensor activity will differ throughout the different contraction types. To test this hypothesis, we recruited 8 Regis University DPT students to participate in the study. Only subjects within the DPT program and without any upper extremity injury were allowed in the study. To prepare, we shaved the participant's dominant forearm and select locations over the bicep and tricep to ensure proper adhesion of the electrodes on the skin. We then recorded a maximal voluntary contraction for both the flexor and extensor muscles. Using a 5-pound weight for each contraction type, the subjects were instructed to complete a concentric, eccentric, and isometric contraction over a 5-second interval. We used those contractions and estimated a percentage that each contraction created relative to the maximal voluntary contraction. We also calculated the mean and standard deviation for each contraction situation. The graph at the bottom of the page shows that percentage of MVC for each contraction type. The yellow bar indicates extensor activity, while the blue bar indicates flexor activity. You will notice that the yellow bar, the extensor activity for concentric contractions, exceeds 100% of MVC. We recognize this as an error in our data collection, as the novice technicians may have inaccurately measured the maximal voluntary contraction for the concentric contraction for at least one, if not more, trials throughout this study. Despite that error, the data did support the hypothesis. We expected that the concentric contraction type would produce the most EMG activity relative to the eccentric and isometric contraction types. We also did note that we expected a difference in the extensor and flexor activity, which you can definitely see both of those situations occurring from the graph of our results. However, due to some of the error, we cannot definitively say that there is a statistical difference between concentric, eccentric, and isometric contraction types at this time, and we do recommend that additional or repeated testing would be appropriate in order to obtain more accurate results. Clinically, this information is extremely useful as it will guide physical therapists to creating a plan of care for their patients. It will also help PTs recognize potential abnormal muscle activity. This could help us uncover potentially a different ailment or potentially a comorbidity that may exist within a certain population that we are working with. Now that we are prepared and understand how the Surface EMG works, and we understand a little bit more about different contraction types, hopefully we can enter the physical therapy profession feeling a little bit more prepared about our clinical testing and then using the results and transferring them into clinical skills and decisions.